is going to be asking the counselor is going to be asking a lot of questions just to get a better sense of what brings you to counseling, what are some of the goals that you may have. And then after that's completed, the counselor comes up with different recommendations as far as the recommended treatment. So once you meet with the intake counselor for that session, it takes a couple of weeks for you to be matched up with your ongoing counselor. And that is the counselor that you would be seeing every week for 12 weeks. Once you complete the counseling, then if you're still interested in long-term counseling, then we'd give you referrals so that you can continue treatment on a longer-term basis. Right now, we do have a wait list for intakes, which is about a month. Right now, we're mostly booked for April, looking to schedule starting next Monday intakes for May. And then once you get that appointment, again, you can, once you get the appointment, then you would do your intake and then have to wait an additional couple of weeks after your intake to be matched up with a counselor. So the second type of appointment we do offer is a counseling consultation. And a consultation is offered much more quicker than an intake, usually within 2 to 5 days from when the request is made. And this is a 45-minute session where you can talk to a counselor about anything you'd like, any pressing issues that you have. Usually it's one appointment, but you might require a follow-up appointment. So it might be 2 appointments. A lot of people, what they do is they request the consultation and also schedule their intake. That way they're at least speaking to someone sooner rather than later while they're waiting for their intake appointment. And then the referrals that we offer, you can ask for a referral consultation if you'd like to discuss specific referrals, or you can just send an email to our intake email and say that you're interested in referrals. We'd send you a list of all the referral information and then identify about 5 different sites that are in network with your insurance, or if you're paying out of pocket, we'd let you know these are the sites that offer, affordable fees.
Thank you.
Okay, so for today, we're going to go through 10 points. So this is what the agenda is going to cover. We're going to go through the good qualities of a therapist, the modalities and specializations, then insurance considerations, things to consider during your search, script for contacting, like how to go about contacting a therapist, support groups and group therapy, websites to search for therapists, referrals for doctoral programs, training institutes, and community clinics. So our first point is, what qualities should you be looking for in a therapist? So there's a lot of different things because each person would be comfortable with different ways in which they want to express themselves and how they want to be heard and understood. So some good qualities you would want to be looking for, it changes by person, but a good listener, help to feel understood, trustworthy, cooperative, adaptable, focus on your needs, helps you establish an effective plan, and culturally competent. So start thinking about like what you think would be the most valuable to you when talking to someone.
And our next point is sort of going over the different modalities and specializations. So specializations are certain issues and disorders that the therapist is trained to treat. So some of these include ADHD, anxiety, depression, substance use, anger management, grief. There's a whole host of options for specializations. So when you're looking for a therapist, you sort of want to think about what you're looking to treat and trying to find a therapist that is specialized in those specific issues. So if I had anxiety, I would want to look for a therapist that specialized in treating anxiety. And modalities are the ways that the therapist treats the issues. So these are things like attachment-based theories, cognitive behavioral therapy, humanistic, Gestalt, mindfulness-based, multicultural, trauma-focused, and art and expressive. And there also is a long list of other options for this, we can send out the list as well. But when you look for a therapist, you want to keep these in mind because if you don't necessarily jive with CBT, then you may not want to find a therapist that just uses CBT. And when you find a therapist that you like, it may be helpful to look at their modality, do a little bit of just background research on what that modality includes, how that would sort of impact your experience with a therapist. And I'm sure most therapists are willing to talk about how they approach therapy, how their modalities impact the way that they treat the sessions. So this can give you a lot of ideas and give you a lot of ideas on how your sessions would go and what you can sort of expect from the sessions. So I'll turn it over to Laura for sort of going over the insurance considerations.
Yes. So when you're thinking about, using insurance, you want to know if the provider that you're interested in or the clinic that you're calling to find out about information about services, if they're in network with your insurance. So in-network refers to a healthcare provider that has a contract with your health insurance plan to provide healthcare services to its plan members at a pre-negotiated rate. Because of this relationship, you pay a lower cost sharing when you receive services from an in-network doctor. So when you use someone who's in-network, you're usually responsible for just paying the co-payment for that session. So when you look at your insurance card, a lot of them will say, you may have a $15 copay, a $20 copay, which means every session that you would see the therapist, you would have to pay those $15 or $20. Some people don't have a copay at all, which is great. So they don't have to pay anything at all. Now, when you see someone who is out of network, it means being a provider that the therapist does not contract with your insurance company. Therefore, the therapist cannot accept insurance-based forms of payment. When you're seeing an out-of-network provider, you will pay the full cost for the session. However, some insurance companies may reimburse a small percentage of the total cost paid out of pocket. So if the fee for the therapist is $100 per session and they're out of network, you would have to pay that whole $100 every time you saw the therapist. But then depending on your insurance, some of them will reimburse you a portion of what you pay. So after you meet your deductible, so let's say you have a $500 deductible. So you would have to see the therapist 5 times, you already paid $500. Then for the 6th session, you're still paying the $100, but now you're filling out a form, sending it to your insurance, and then they'll give you back, let's say $40 from what you paid. So it's important to contact the insurance companies and ask if you're seeing somebody out of network, do they reimburse for any portion of what you already paid? And I see we have a question. So for students that don't have direct insurance that can be applicable to be able to therapy, what would be the options for students? Okay, so the other option would be to utilize sites that do sliding scale fees. And the sliding scale fee is where you're paying for your session, and a lot of the clinics or clinicians will base the fee upon what your income is. So they might ask you to submit forms, just proving your employment. If you're not working, then they might have a set fee that is the minimum that they're able to accept. So for both nonprofit clinics and private practice, some therapists do use this method to make sure that therapy is accessible for those that can't afford standard rates. It is important to be able to verify all this information. So, if you are using your insurance, make sure that you're first calling your insurance and finding out the information of how much is it per session. Is there a limit of how many times I can see a therapist? Some insurance companies don't have a limit, but some do. They might say, you're only able to get mental health counseling for 25 sessions. So it's important to know that information as well. And then when you go to the insurance websites, when you're looking for a therapist, they also have their provider listings. So you can use that as a guide and see what therapists or clinics are within their network and explore those options as well.
Okay, so now we're going to talk about some things to consider while looking for a therapist. So we definitely want to utilize the search bar. You can definitely search specifics that you want in a therapist and things that you're looking for. Even with the types of insurances, you can type in and find all of that. Also just looking up the different types of therapies that you think is best for you. So there's individual, couple, family, group therapy. There's also different types of durations in certain therapies. There's short term, which is like solution-based therapy, 3 to 6 months, 6 to 12 months, and then 1 to 2 years, which is long-term and more trauma-based therapy. A couple of the client focuses that you want to find is with ethnicity, language, religion, or spirituality, even with the LGBTQ community. If that is something that you want to talk about, you want to make sure that your therapist has knowledge on the LGBTQ community as well. Questions that you can ask yourself are, what is important for my therapist to specialize in? What you think is most important for you? Do you want a therapist that can treat any specific issue like anxiety and depression? Do you want a therapist that works frequently with POC or LGBTQ plus communities? And then also how immediate, your need for therapy is. If you want to, if you find a therapist that isn't taking any new clients, you don't really, you might not want to like wait around for that. You might want to just do like more research and try to find maybe different people that specialize in the same things. And then this is just the way that you can go about, talking to a therapist and figuring out like how they, what their process is. So like, for instance, my insurance is Anthem. So I would just be like, hello, I'm interested in seeing a therapist for ongoing counseling. Are you in the network with Anthem Insurance? Are you accepting new clients? How soon can I get an appointment? What is the intake process like? And how long until I am working with the therapist? Do you have a therapist that specializes in anxiety for me, or has any experience with anything that you're dealing with? And then also always list these when leaving a voicemail, so they have all of your information, like your name, telephone number, so they can call you back, the name of your insurance company, so they can also make sure that they cover that, or also, again, if they're taking the new patients, because sometimes that is an issue you'll run into with certain therapists. You can also just describe your current issues or things that you want to talk about, so they have just a background idea. And then also your availability. You want to make sure that the days that you're free, that they have time for you, and all that fun stuff.
Yeah, and the last little bit is if you have to leave a voicemail, that's just sort of a quick script for what you can say. You don't have to include like your whole entire history into the voicemail. And all of these will be posted afterwards as well, so you don't have to scramble to take pictures or write it down. And I will turn it over to Laura for this conversation on groups, support groups, and group therapy.
Yeah, so besides individual counseling, a lot of places offer either support groups or group therapy. So before I go into it, at the Counseling Service Center, we usually have different support groups that run throughout the semester. So sometimes when someone is waiting to be in individual therapy, but they decide I want some sort of counseling now, they might want to join one of the support groups, or they do it in conjunction with their individual therapy. So for this semester, we do have our LGBTQ support group, which runs every year. We also have a DBT support group. And then in the past, the support groups have all varied. We've had a Women of Color Collective support group. We've had a grief support group, meditation support group. So again, it always changes depending on what the need is for our center at least. But when you think of a support group is typically made up of people who are all working together through similar mental, emotional, or physical situations for either themselves or their loved ones. And these types of groups meet regularly and have an ongoing schedule. So it might be once a week, it might be twice a month. Whereas group therapy is also centered around a group of people experiencing similar situations, but this treatment option is more structured than a support group. So you would often see that the therapist is usually the one guiding the conversations more. They might have different exercises that they would be doing. And the sessions usually have a very fixed time frame. So it might be just a month, it might be 2 months, 3 months, whatever it is. And the therapist, provides a lot of guidance to work through the issues together. So while both support groups and group therapy offer support, the goal of group therapy is to help members change, while the goal of support groups is to help members cope. Support groups tend to have a particular theme, such as parents with sick children, and all who attend have some sort of connection to that specific theme. So just to add, like for group therapy, you usually see group therapy more in different mental health settings where they're treating a lot of clients, a lot of patients that all present with the same issues. So for example, if this is a community-based clinic and a lot of the people that they're seeing are coming in for anxiety, then they might do a group therapy where all these different clients that are coming in for issues related to anxiety are coming alongside with their individual therapy.
And I'll briefly cover some websites that you can check out when you are looking for a therapist. So NYC Well, they do offer a 24-hour hotline that provides free and confidential mental health support. And aside from the hotline, their website also has a search function that you can search for providers that treat your specific issues. ZocDoc is also a popular website, not just for therapists, but any type of doctors. So you can find specific mental health specialists, counselors, psychologists, psychotherapists, and psychiatrists on the website. Since it is a website that covers, I'm pretty sure almost every type of doctor, you do have to specifically search for therapists and make sure that you're looking at just those types of practitioners specifically. But the cool thing about ZocDoc is that you can also input your insurance plan into the search bar, and it will only show you therapists that take your insurance. But it's sort of tricky the way it displays. So it'll show you a couple that take your insurance, and then right below it, it'll have a couple that don't. So you just have to make sure you're looking closely. And obviously, whatever therapist you're looking out for, you would definitely want to double check with them that they do take your insurance, and just to double check, you don't want to assume and then have all these costs. And the next one is Psychology Today, also a very popular website for finding therapists. So you can find therapists, treatment centers, psychiatrists, and support groups. And similar to ZocDoc, you can tailor it for specific issues. You can put in your insurance. You can look up the therapist's gender. If you only want to work with a woman, you can put that in there. The different types of therapy, so CBT, things like that. You can look at the age that they specialize in. I believe it's the age they specialize in and not the age that the therapist is. So if you are an adult, you want to work with somebody that works with adults and not just exclusively children. You can put in a price range. You can look at their ethnicity or ethnicities that they are familiar working with, sexuality, language, and faith. So quick note on faith, I think this one, especially if say you're you're part of the LGBTQ plus community, you may not necessarily want to find a therapist that is Christian. Those are things to consider, that how those different things intersect. If a certain religion does not jive with a community that you're in, you may want to be mindful of that. And also, I'm speaking from personal experience here. The first therapist I ever had was Christian based. And I personally didn't like it because all of her treatment methods were from a Christian focused lens. And that was not something I was looking for. And it wasn't something I was aware of at first. So you would definitely want to be mindful of how someone's faith and all of these different things, faith, ethnicity, language, sexuality, how those play into what your therapy session would look like. And Hello Alma is another website where you can find quality and affordable mental health care is what they focus on. So you can search for therapists by type of insurance, type of service, zip code, and if you want virtual or in person. That's another thing to be mindful of. I think, especially with COVID, a lot of therapists, in my experience, have not fully switched back to in person. So you have to sort of think about if you are able to do therapy virtually. And then another one is Therapy for Latinx. So this website helps connect Latinx individuals with therapists who are culturally competent. So they specifically only list therapists who they know are culturally competent and can work with this community. So you can search for therapists with keywords and your zip code. And the last one is Open Path Collective. So they have, basically it's an organization that partners with therapists from all over the country, and they exclusively only provide therapy for $30 to $60 a session. So when you're matched with a therapist, you know that you are only going to pay between that amount. And the website focuses specifically on low-cost options. So they do have an application where you sort of have to say why you're looking for these low-cost options. Sometimes they may ask you to include your income and things like that, because they really want to make sure that the website's not sort of being abused in the way that people who can't afford what they call the market rate for therapy are not taking up all the spots. They really want to cater to people who cannot afford the current market rate for therapy. So the one-time fee is $59 for the application. After you pay the $59, you are connected with the network of therapists for $30 to $60. And along these, I would say also do your own research on the websites. These are all suggestions, but you can sort of check out the websites, get a feel for which one works best for you. And yeah, there's a huge network. I don't even know how many, probably thousands, if not more therapists on these. So if you do your research, you should be able to find someone good on these.
Okay, and now we're going to review the different types of referrals. So we have an extensive referral listing, and we broke it down into 3 different types of referrals. The first one is the clinical psychology doctoral programs that offer low-cost services. So a few of those programs that you should consider would be the one at City College. They have one at Columbia University Teachers College and at Adelphi. So what's unique about these sites is that even though these are all universities and colleges, they don't just offer counseling services to their students like John Jay does. They actually offer counseling services to the community at large. So each program has its own specific considerations, but they do offer low cost fees. Again, that varies and it changes over time. So if you're interested in any of these sites, Once we share the referral listing, you would have more information and you could call them. I will say that from my experience contacting these sites, sometimes they tend to have a little bit of longer wait lists because of their affordable rates. But, when you're looking for a provider, I always say, call as many places as you can and put yourself in different wait lists and just kind of see what pans out first if you're looking for, services sooner rather than later. And then the second type of site is a training institute that also offers low-cost services. So training institutes offer training programs for mental health professionals who are specializing or looking to deepen different therapeutic skills, and they offer low-cost therapy services. So in this case, it's likely that the therapist you'd be working with is a therapist that is still in training to some capacity. So they might be, pursuing their doctoral degree, there might be a master's level clinician, but they are being supervised by licensed mental health professionals. So for example, at the John Jay Counseling Service Center, we do have some of our counselors that are licensed mental health professionals, but then every year we have externs that join us from different programs, and they're with us for the full academic year, and they are in training. They are supervised by our licensed clinicians, and their levels of education, vary. Some of them are master's students, and again, some of them are pursuing their PhDs, but this is not their first experience providing counseling services. These are externs that already have provided therapy in other settings before. So just a few of the institutes that you can consider would be the William Allen White Institute, National Institute for Psychotherapies, Training Institute for Mental Health, Manhattan Institute for Psychoanalysis, NYPSI, National Psychological Association for Psychoanalysis, and the Center for Modern Psychoanalytic Studies. And again, each program has their own considerations. So when we share the document, you'll have contact information for these sites and websites. And then lastly, we have the community mental health clinics. So community mental health clinics are programs that are community-based and provide mental health services, sometimes as an alternative to the care that hospitals provide. They are supported by sources such as county and state funding programs, federal funding through programs such as Medicaid and Medicare, private insurance, and cash payments. So, for the community-based clinics, they're servicing the entire community, and they do get a lot of referrals from the hospitals. So sometimes their wait list can vary a little bit as well. But just some recommended sites that, we refer students to would be the Metropolitan Center for Mental Health, the Puerto Rican Family Institute, the Institute for Family Health, and they have multiple locations in Manhattan, and the Postgraduate Center for Mental Health. Again, each program has their own specific considerations, and we'll share the information, phone numbers, and websites in our document.
So like Laura said, the long referral list has much more information about the specifics and things you should keep in mind for each program. So we'll send this out through Discord and email, but you can also email our club email, jjactiveminds@gmail.com, if you want a copy of the resources.
Yeah, and if there's any, specific questions, you can also email me. My email is ldiaz@jj.cuny.edu. I also manage the intake email, so you can also send any questions at intake@jj.cuny.edu. And you can email Dr. Corey Head if you are in any crisis situation or are interested in a consultation. You can either email her or email me, and I'll forward her the information. And then any additional questions you can send to our director, Gerard Bryant, at gwbryant@jj.cuny.edu.
Yeah, so we have a little bit more time before it hits 3 o'clock. So if anyone has any questions. I know that was a lot of information, so I do want to open the floor to questions. But really quickly, special thanks to Laura for providing all this information. It was super helpful. I personally am going to take advantage of it for finding my own therapist. So I really appreciate your help with it and all the resources. And very quickly, our next event is on April 4th, which I think is next Monday. And we'll be talking about how the pandemic has impacted mental health. But that's the last bit I have to say. I will leave the floor open for any specific questions about what we talked about.
There's one thing I actually forgot to mention. We also do have 2 part-time psychiatrists at the Counseling Service Center that started with us this semester. So usually you would have to be receiving individual counseling in order to see the psychiatrist. But if you are interested in seeing a psychiatrist, then you can also email us for more information about that. Because referrals for psychiatrists can also be very challenging in the community. Some of the sites that I shared do have psychiatrists as part of their team, but others don't.